Today's session covers the following domains: fundamentals of biostatistics and its role in evidence-based medicine, key study designs and levels of clinical evidence, methods of representing and interpreting data, understanding type 1 and type 2 errors, statistical significance versus clinical significance, confidence intervals and their implications, and finally, comparative risk metrics, including relative risk, odds ratio, absolute risk, and NNT. After completing this on-demand webinar, you will be able to define essential statistical terms in the context of drug evaluation, differentiate between types of data and understand how clinical data is represented, interpret p-values and confidence intervals, evaluate real-world clinical studies using risk ratios and absolute risk metrics, understand how study power and sample size impact reliability. Each of these statistical skills is foundational to the clinical decision-making process across practice settings. Biostatistics is the use of statistical methods and testing to evaluate and interpret health-related data. In pharmacy practice, biostatistics is foundational to evidence-based care. It helps us evaluate the efficacy and safety of medications, analyze health outcomes, and interpret study results to guide our clinical decisions with confidence. Consider a patient with diabetes. When reviewing a new anti-hyperglycemic agent, it's not enough to see that HbA1c levels declined. We also need to determine if that change is statistically significant and, more importantly, clinically meaningful. Even if you've studied it before, revisiting biostatistics is essential. These skills can fade over time, especially when they aren't part of daily clinical routines. By strengthening your understanding of biostatistics, you reduce uncertainty, improve data literacy, and ultimately drive better, more confident patient care. Pharmacists who master these skills can interpret drug literature more effectively and contribute meaningfully to clinical decision-making. Study designs in medicine typically fall into two categories: studies in which subjects are observed and studies in which the effect of an intervention is observed. Meta-analysis is a statistical technique used to combine the results of multiple studies from a systematic review to provide a single, more precise estimate of the effect. Meta-analyses provide the highest quality of data. This is due to their wide scope and significant statistical requirements. Systematic reviews are comprehensive and structured literature reviews of all relevant studies. Systematic reviews aim to identify, select, and critically appraise all relevant studies on a specific research question. Experimental studies, clinical trials, are studies with interventions involving experimental groups and control groups. Randomized trials represent a higher level of evidence than those in which subject selection is not random. Observational studies may be forward-looking, also known as cohort, backward-looking, also known as case control, or looking at simultaneous events, also known as cross-sectional. A cohort study is one in which subjects initially disease-free are followed up over a period of time. Some will be exposed to X risk factor. Experimental studies are structured to minimize bias and isolate the effect of an intervention. These can be either controlled trials or non-controlled trials. Within the controlled category, further distinctions exist based on how comparison groups are selected. In a randomized controlled trial, or RCT, patients are randomly assigned to treatment or control groups, thereby reducing selection bias. By contrast, non-randomized studies may use historical controls or self-controlled designs, which can introduce confounding. A confounder is a variable that is associated with both the exposure and the outcome, but is not in the causal pathway between them. Because the confounder influences both the exposure and the outcome, it can create the false appearance of causality or mask a true association between the exposure and outcome. Two common designs in clinical trials are parallel group and crossover trials. In a parallel trial, participants remain in their assigned group for the entire study. This is ideal for interventions where long-lasting effects are expected. In a crossover design, each participant receives both the intervention and the control at different times, with a washout period in between.